you're all set.
How do you adjust the slides?
Just a down, 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 or an up, up, up. Okay.
Good morning. And thank you to the RiverMend people and to especially Dr. Gold for this historic meeting today. It's certainly something that will be the first step in a journey of 1,000 miles. First of all, let's look a little bit back in time, because modern evidence-based medicine really requires objective, reliable tests to manage the chronic disease of substance abuse. Without a doubt, the United States in the last 25 years have developed the most effective and reliable substance abuse treatment programs in the world. Well, at least the drug testing part is good. And if you take a look at it, you saw at that point in 1988, there was 14% of the American workforce were positive. Now, I'm sure there was a lot more. We just simply didn't have the technology at the time to test them. The workplace drug testing that you see here measured only 5 drugs: marijuana, cocaine, opiates, PCP, amphetamines. And it certainly is not reflective of the horrific shift in drug abuse that's going on in our nation right now. Prescription drugs, bath salts, spice, and other designer drugs, our epidemic proportions are literally challenging our society and the future of our society. But not to worry, I believe technology will catch up with it. Because look, clearly, drug abuse for the 9 to 5 has gone down with drug testing for them. Now, I believe the same thing is going to happen with these new designer drugs as well, as soon as we develop the appropriate technologies to test for them. Now, it may happen here at Pepperdine, it may happen up the road in Stanford, or it may happen in my garage this weekend, or somebody like me. So with that, let's take a look at what the drug testing market and what the drug testing area was 20 years ago. 12 million drug tests, 5 million mandated, meaning federally organized tests, mainly urine. Today, we have a variety of drug testing samples. We have urine, we have hair, saliva, and breath being the most common. We also have lab tests, and we also have instant tests, or point-of-care testing. And, let's just go back one more. And we have over 200 million. I would actually say, since the data is not really easy to get, there's probably closer to 500 million drug tests that we've done in the last 25 years and have a very huge, large evidential database to make some very important conclusions. Now, in order to really understand this, we have to talk about the 3 major components where drug testing has emerged into, because it isn't all urine anymore. First of all, saliva parallels the blood compartment, and it also parallels the breath compartment. So if you look at it over time, if using a drug and measuring it in saliva will parallel or give you an idea of what's going on inside of the blood compartment, which would give you an idea of impairment. A good example is alcohol. Alcohol will go through your system in saliva and in blood and in breath in a drink per hour. Now, urine is the one that was studied for the most part, and depending upon the drug and the state of the individual, you could test in urine for days. And hair, which is also the 3rd major drug testing component, gives us a time of and I don't see these, does it show up there? For months, okay? The reason for that is that it takes some time for the drug to go from the bloodstream into the follicle of the hair. But there's also 2 other components of hair drug testing. There's environmental, and there's the sebaceous, or the sweat that's coming off of your body and on the outside of the hair itself. So another important piece is that after you use a drug, it could take 7 to 10 days for that drug to enter your follicle. So this is a test that will give you a sense from 10 days to maybe 3 months out. The newest tests on the market are these instant drug screens, and there's a variety. They're made by over 70 different companies, and I've talked with you during this time here. Some of them are very disappointing, but some of them are made better, and it's really probably the wave of the future to do more point-of-care testing. But there is a limitation on the amount of drugs that they could test, and also if it's positive, they need to be confirmed. The newest entry is saliva into the drug testing market, again, which is similar to blood, so it gives you an idea of impairment. And there's two components. There's instant drug testing, which will give you a very limited menu, basically the SAMHSA 5 drug test. But that will happen within 10 minutes. And if that does happen, you need to confirm the test by a laboratory. And the second is the laboratory-based test, where they collect the specimens and send it to a laboratory. Now here, you have a wider range of tests, confirmatory tests, lower sensitivity levels, and it works really well. Now, as we develop all these technologies, there's still the anti-drug testing products out there. This one advertises itself as the choice of Fortune 500 executives. They're going to give you 2 if you buy one, and if you're lucky enough, you'll give you free overnight shipping if you buy $135. This is interesting to me because there is still a very large market for clean urine. Yeah, as a matter of fact, Von Miller of the Broncos recently admitted that, he had used that in his drug test. And also, the next one, the prosthetic device, was used by an Italian runner just last week. So we have a number of products out there that will compromise drug tests, so you need to be aware of that and have appropriate testing systems set up for adulteration and perhaps direct observation at time. Breath testing, it only will measure for an hour a drink. Think of that as a rule of thumb. So if you drink 6 beers and then you come back 8 hours later to your clinic, it really isn't going to help you very much. The most common type of breath alcohol test is a fuel cell. There's a whole list of NHTSA approved testing that you could use. But in a zero-test program, a zero-tolerance program, you really need to know if somebody has had it 1 drink 1 day or 2 days ago. And that's what we could do with an ETG and ETS for zero tolerance. And there's a new test that's out there right now which will be able to monitor binge drinking, which is an important thing, I think, that we would all start developing in the near future. Now, help me understand. Let me look at this. What does this guy, this guy, this guy, and this guy have all in common? They never failed a drug test, okay? It's because of this guy in Balco Laboratories and Biogenesis in Coral Gables, Florida, which provides them very sophisticated techniques in order to get around all of this. So it is the next growth industry of getting around drug tests, because we are the early warning system of this disease. And it doesn't stop there, because with the advent of bath salts and all of the newer drugs hitting the market, the cartels are trying to go and differentiate themselves by adding pharmaceuticals to crack cocaine in order to make them a new product line that they can sell. And one of the here's just a list of them there. One of them that we've seen in Florida is it there? Yeah, levamisole. 90% of all of the cocaine deaths in Florida are positive for levamisole in their system. And this isn't going to stop with crack cocaine. It's going to move on to heroin plus, meth plus, marijuana plus. And what's a guy to do? What's a clinician to be able to do in a situation where we have literally hundreds of designer drugs coming out on a monthly basis and more of these poisons coming into our environment? Well, you have to start with the basics. And we're no longer a 5-drug panel. We have a 10-drug panel that's being used. And you can see that we have barbiturates and benzodiazepines out there. And here's a typical 20-panel test, which doesn't include all of the tests, that may go and screen for upwards of 60 to 70 types of drugs coming in into the market at this point. Now, in summary, thank you. Best practices, let's go and get a comprehensive urine drug screen on admission, laboratory-based, Hair, saliva, and urine will give you a 30-day picture, looking out in time. It'll start from 3 hours, 3 days, and 3 months. Instant during treatment, on passes, during outpatients. Prescription medications and synthetics have to be included, and they are on a regular basis. Vary the drug test, not just one drug test. Maybe you do it by a standard, an expanded panel, single drug test, hair drug testing, saliva, urine, instant saliva, urine laboratory. And there are new technologies that are coming out that I know in my heart as a technologist that are just going to be stunning and startling. And it will take existing technologies that we don't even have to invent, just have to wire them all together, labs on a chip and other types of technologies that will make us able to see much more clearly the addiction profile of an individual. And in summary, remember to treat the patient, not the laboratory test. There's no laboratory tests I could think of for your clinical judgment and your compassion with your patients. They will thank you, their family will thank you, and I thank you for your kind attention.